The next speaker is Mr. VG Wimalasena. He is the principal of the Sri Lanka School of Radiography, and he is Vitarana Gamage Wimalasena, received his first appointment as a radiographer in 1975 after following the diploma in radiography course in the Sri Lanka School of Radiography. And in 1981, he also completed the BSc in Electrical Engineering at the University of Moratuwa, Sri Lanka. Sena has been serving the Sri Lanka School of Radiography as a teacher since 1989, and currently he is the principal. Further, he serves as a radiography teacher for the MD Radiology Part 1 at the Postgraduate Institute of Medicine since 2001. He has been involved in conducting CT diploma training programs for radiographers. He has served also the Institute of Health Sciences in the Sultanate of Oman as a radiography teacher. Mr. Wimalasena has received training in image technology in Japan and teacher training in Mahidol University, Thailand. He has also followed a distance-assisted training in nuclear imaging conducted by the International Atomic Energy Agency. And he has attended several short-term training programs in Sydney, Shanghai, and Singapore. His papers were presented at Japan Society for Radiological Technology Conference in 1994, 19th Asia-Australasia Conference of Radiological Technologists in 2013, and the International Society of Radiographers and Radiotechnologists World Congress in 2014. He will speak to you today on professional approach to radiation protection.
Good afternoon. Thank you very much, sir, for a kind introduction. Thank you for the invitation. In this presentation, I'm going to discuss about these 4 topics in brief: professional practice, biological effects of radiation, radiation protection, and the evidence-based practice as applied to radiography. Just look at what a profession is. These are the recognized traits or the characteristics. Having a specialized knowledge acquired only through higher education, and presentation by professional organization, representation, and distinctive code of professional conduct, and the independence or autonomy to practice, and the altruism or the working for the benefit for the patients or the others. So if you take the specialized knowledge, if you compare the training programs in other countries and in Sri Lanka, in developed countries, this is not only for the radiography but also for the other allied health professions. In UK, now the basic program is the degree, and whereas in Sri Lanka we have a diploma and a degree now, and we can go up to masters also. And this is our professional organization in radiography in Sri Lanka, but still we don't have the right to give authority or the licensing, issuing licensing for the radiographers, but the practice to license in Sri Lanka is issued by the Sri Lanka Medical Council, not only for the radiography but also for the other. And the code of professional conduct, so it defines the role, and you can see, I think this thing you already know, so I don't have to give more in detail. And the autonomy is whether we have the freedom or the independent practice. You just think of whether in Sri Lanka we have that independent or freedom to practice by our own. And the altruism is, that is what we are supposed to do, to work for the betterment or the welfare of the patient. That's I just request for the students mainly. So here in the professional practice, so these are the skills or the competency that we should have. And here I'm going to, in this presentation, I'm more deliberate on the evidence-based practice. Right? So the evidence-based practice, so it helps to provide the justification for clinical decisions and diagnostic efficacy, treatment decisions as patient care, and it defines the best practice. Right? So if you take the radiography knowledge basis, we apply the evidence-based practice for image acquisition, image or techniques, or the dose management, image optimization, and the technological development, patient care, treatment, and outcomes. Here I have highlighted the dose management because in radiography, the thing that we concern is the radiographic unnecessary radiation dose we give to the patient, how to minimize that. So therefore dose management is necessary. So they just have a look at about the biological effects of radiation. So under this I'm going to describe the radiation interaction with the matter, biological effects, radiation measurement and the protection measures. Now this is what happens when a beam of radiation interact with the patient or anybody. You can see the radiation is energy, it's a kind of energy. So the most of the energy is absorbed by the patient or the body, and some of the energy is pass through, and that is what we use to produce the images, to make the images, and some of the photons scattered outside. So that will that is the cause for the unnecessary dose to the staff or somebody around the patient. Now, the absorbed dose, when the radiation is absorbed by the patient, so these are the things that happen. The effects are categorized in two ways. One is as a somatic, or the effect on the body, and the effect of the germ cells, or the genetic effects. And it can be classified as the deterministic effects and the stochastic effects. Now, mainly the radiation or the energy affect the start with the cell. So you know, this is the cell, this is the chemical composition of the cell. It mostly has the water, and the most important part is that it has the DNA and the other nucleic acids. So the action of radiation on the DNA will cause the damage to the cell, and it will finally produce cancers and all of that. So the effect of radiation is mainly caused by the ionization. What is that? So that is why the X-rays and this radiation now we call the ionizing radiation. So that ionization means the energy gives to the electron in the outermost cell electron in the atom, and that electron is removed from the atom and becomes a positive ion and a negative electron. So these ions can go and react with the other atoms and produce more ions, and those ions will react and can cause damages to the DNA molecule. So the damage can be caused in the two ways, so either by direct action or indirect action. Direct action means the radiation photon directly act upon the DNA molecule, and the indirect action means the water molecules ionized and can go and produce the breaking. And so the effect of the radiation on the cells, so it may be undamaged, or the cell may be not damaged, but late end the cell can be damaged, and it can repair and work normally. But some cells can be repaired, but they are not normal, they will become abnormal. So that will produce later become cancers, and the cell may die. So the consequence is the most cells that die are in little consequence, but because the body can just replace them. The cell change permanently may go on to produce abnormal cells when they divide. So in the right circumstances, these damaged cells can become cancers. So this is the origin of increased risk in cancer as a result of radiation dose. And when you want to quantify, if you want to measure this damage, so we have to just see to remove an electron from an atom, we need only few electron volts of energy. But the ionizing radiation carry very high energy measured in kilo electron volts or mega electron volts. So therefore it has a potential to produce more ionization events. And if you take, normally to produce the images we use X-rays or gamma rays, but we have other radiation like beta particles and alpha particles. The effect on the human body of these beta and alpha particles are very high than compared to the X-rays. So therefore, when you measure the dose, we define three types of doses: the absorbed dose measured in gray, and the equivalent dose measured in sieverts, and the effective dose measured in sieverts. So 1 gray is a dissipation or absorption of 1 joule per kilogram. So this is how the equivalent dose is defined. The absorbed dose is multiplied by a factor called the radiation weighting factor that gives to standardize the dose related to the type of radiation. So you can see the different types of radiation have a different weighting factor. For the most highest weighting factor is having the alpha particles, because the alpha particles can cause most damages. And other one is the effective dose. Because the radiation, the sensitivity of different tissues to the radiation is different. So therefore, to take into this account, we have introduced this factor called the weighting factor. So therefore, by multiplying the weighting, by the weighting factor, we get the effective dose for a particular organ. So these are the weighting factors for the most sensitive organs. You can see the most sensitive organ in the body is the gonads. So the germ cells are most sensitive, which has the weighting factor of 0.2. So the effect, again, we talk about the radiation effect on the health. The first we use the deterministic effects and the stochastic effects. Usually the deterministic effects are concerned with the high acute doses, very high doses, and the stochastic effects are concerned with low doses, where what we for example, what we receive in radiographic examination or in diagnostic radiography. And this and as a graph, you can see the deterministic effects are produced by after receiving a very high dose. There's a certain limit. So when the dose is lower than that limit, the deterministic effects are not produced. But whereas in the proper stochastic effect, even the low dose can produce a stochastic effect. So you can see that these are the deterministic effects, and the amount of radiation that receives that should have to produce the type of deterministic effect. For example, to get eye cataracts, we need at least about 5 gray of radiation. If the radiation is less than that, you won't get cataract. And this is the elaboration of the stochastic effects. You can see normally the stochastic effects are, this graph is produced by estimating or the extrapolating. Usually we can see the effects of, we can observe the effects of radiation at high doses, and it is extrapolated to get the effect of the low doses. And finally, you can summary as a summary, you can see the radiation it can be molecular or subcellular or cellular or tissue or organ or the whole animal or population, or it can go into the offsprings, like they call the genetic effects. And let us see how we can protect the patients from radiation. The patient are the people who receive the most amount of radiation during undergoing diagnostic radiographic examination. So therefore, we apply these 3 cardinal principles. We call the justification, optimization, and the limitation. So what we do is we have to justify all the radiographic examination by taking into account the risk and the benefit. So if the benefits are more than the risk, we can justify, we can perform that procedure. Otherwise, we will have to look for something else. And the optimization, that is, as radiographers, we have to use the minimum amount of radiation to produce the high quality images during the examination procedures. Right? And the International Committee on Radiation Protection have introduced some dose limits where the people to avoid the stochastic effect, to minimize the, not to avoid, at least to minimize the stochastic effect. For example, anybody can receive, anybody receive the background radiation should be less than 1 to 2 millimeters per year. And the general public should not receive more than 1 millisievert per year. And the radiation workers can receive only up to 20 millisieverts per year. And if you take a pregnant lady, she can receive only up to 2 millisieverts as a patient only. Right? And so this slide shows some radiation doses received in diagnostic examination for a patient. So you can see in the last column, it is given the estimated lifetime risk of fatal cancer from examination. In most of them, it is low. And if you see in the second row, the computer tomography of CT or abdominal pelvis repeated with and without contrast material produce a moderate risk. Right. So therefore, we use the evidence-based practice for the dose reduction, that is for the justification of examination. No, it is the evidence-based practice in radiography. This is the definition. So that is the holistic approach. Okay, and so therefore we use the evidence-based practice to justify the examination, and what we have to do is we have to take these three into account: the clinical expertise and the experience of the health professional, and the patient values and the patient preferences. So I think this type of slides you saw in the previous presentation also. And the best patient values is again important here. For example, if you take, to diagnose colonic cancer, right, we do a CT colonoscopy or conventional colonoscopy, or we can do double contrast barium enema examination. The patient might prefer to undergo a CT colonoscopy to a conventional coloscopy. Therefore, that also has to be taken into account when you justify. Now, evidence-based practice, there are 5 steps or 5-step framework. That is, we have to formulate a question, and we have to find the evidence, and we have to track down the best evidence with which to answer the question, and that is, we have to critically appraise the evidence that we found by searching the answers for the question, and then after critically appraising, we find the best answer, then we apply the answer, and then we have to evaluate the result. For example, if you want to formulate a question, this should be a concise or clear and focused on the clinical problem that we have to answer, and it should facilitate the literature. For example, now to produce a well-built clinical question, these 4 things have to consider: the patient or the problem, and interventional type, or the examination or the comparison examination, and the outcome. So that gives we call the PICO format. So by taking into this PICO format, we just take a clinical scenario. For example, if you say CT colonography or double contrast barium enema is more accurate in detectability of colonic cancer, or you can get another one: what treatment planning technique of A or B are best for cancer breast patients when it comes to minimize radiation to the heart. And another one: what is the best age to start a screening mammography for a female? Even sometimes maybe your neighbor might ask, so if he has abdominal pain, so what is he supposed to do? Is it good to take an X-ray? So we have to give the answer. So this evidence-based practice can be used to find the answer for that. Right? So therefore, similarly, if you take as an example the second one, the CT colonography. So if you take that question, this is the double contrast barium enema images. So this is done by inserting an enema tip into the patient's anus, and by giving an enema consisting of barium sulfate solution as well as air injected. So the patient might not like to undergo this, and the diagnostic value also is what we have to is we have to compare the diagnostic value of this one and the CT colonography. And this is CT colonography. In this one, the patient doesn't have to undergo any enema or anything. You just lie on the CT couch, and the examination is done. So you can even see like a virtual colonoscopy, the inside the colon. And so therefore, we have to, and what about the radiation dose? That is what you have to find out. And what is the diagnosis? What is the accuracy of the diagnosis? Those are the questions that we have to answer. To do that, we have to do this searching for the evidence. So this is how that the PICO is applied to find the correct, to get the correct question, right? So the P stands here, the P is the colon cancer, and what is the investigation 1 is CTC, and the investigation 2 is the DCBC or double contrast barium enema. So what the finally outcome is the accuracy of the diagnosis. Okay. So to find the evidences, so you have to use the databases. So these are the databases available. You can go through all the researchers and you just you may find different answers. So after getting the results, so we have to analyze the results or appraising the evidence. So after collecting the information, appraise them. So to find the best solution, you have to use this hierarchy of evidence hierarchy. You can see, so the most accurate answers is on the systematic or review and meta-analysis. And the anecdotal means what your colleagues say, what the colleague says. Sometimes the colleague might say the barium minima is good, or the colleague might say CTC is good, like that. So you have to analyze. After analyzing, you get the correct answer and you apply that. So in this one, you will find the CTC is more accurate in detecting polyps, so about more than 6 millimeter in size. So therefore, the CTC is recommended. So we do now almost we do CTC instead of DCBC or double contrast barium minima. So evaluating the outcome, what will happen? So the CTC become a popular, and this double contrast barium has a limited life expectancy. But the CTC, we need to have a CT instrument, and it is very expensive, and like that. So it have the implication regarding the professional development of and we have to educate the practitioners also. And finally, as a conclusion, I will say decision making is the evidence based. So in health professional should provide care based on the best available scientific standardized knowledge, and implementing evidence based radiography or evidence based and other practices. Professional practice should offer a contribution to the rapid development of radiography as a discipline. So the professional practice contributes towards a healthier nation. Okay, thank you.